came in 1994 formally, and I was appointed as the first Dean of Nursing within the university sector. But prior to that, I'd been here on numerous occasions working with my colleagues from across the sector on a range of curriculum documents and research initiatives and I guess formal documents for the regulatory bodies. So I was familiar with the university for at least a decade prior to my arrival in 1994.
How did you arrive here? How did you find yourself at the university on the academic staff?
At that time, the college sector was coming to a close, and they were looking for new directions for nursing, and they were looking for a new profile of research initiatives. And I was a number of staff who were really wooed to the university, I suppose, so that they might bring about a change in direction for the nurses who'd already been within the University of Newcastle for a decade. I was to lead the renewal of the undergraduate programs so that they were consistent with bachelor level studies, and I was to lead the initiatives around research, a research profile in nursing. So the first masters and doctoral students were emerging at that time, and we needed to put in place new approaches to how we were going to manage partnerships with the local health services in such a way that we created a research agenda and we realised that agenda.
Have you seen changes in that department? Is there anything different, basically, from when you started in 1994?
Oh, I think there's an enormous difference now. I think there's a real sense of a profile of the profession being evidence-based. We have a legitimacy, I think. There are many, many graduates across the world and across Australia who have led initiatives, for example, South Korea, Thailand, the Maldives. So people have come here, completed their doctoral studies and master's level studies, and then they've returned to their own places of work and created change. And indeed, South Korea, as an example, changed its approach to how they manage students entirely. So things like problem-based learning became part of the fabric of nursing across South Korea. So there were really influential alumni who were among the first people that I and others worked with as research higher degree students.
Are there any significant achievements been by the students you've had? Any significant achievements that you're aware of?
I think the biggest, I could pick at least two. There are numerous, but the two that I would choose would be pain management. So a significant number of people have worked with their medical colleagues to approach the management of pain at the local level here in the Hunter, so that people with intractable pain, pain that's really chronic pain, that's really hard to manage, can be approached entirely differently from a medical regime. So I think that's probably one of the greatest achievements around symptom management. There are other folk who work, for example, with asthma, so people who are managing respiratory problems. So there are some key leaders locally who work with prominent medical folk locally. The other area, I think, is in aged care. I think we've seen a huge growth in the numbers of nurses who work in aged care, but they work in a way that really focuses on the needs of the elderly, keeping people in the community, keeping them out of acute care, which is not good for them, and really coming up with new recipes, really, for how to grow old, more graciously perhaps, but also even to die in a dignified manner. So many, many graduates have been prominent in that area. And the other one I think might be mental health, nurse-led initiatives in mental health. So you might see in general practices now a whole lot of nurses who are actually taking a caseload and managing people with challenges, long-term challenges in mental health. So they've come up with different approaches to managing that chronic disabling life experience.
That must have been very rewarding for you personally to see this happen.
I think it is. I sit now on a local health district board, and I'm one of 7 people, but I'm the only nurse at the table. And I think one of the things that we've been able to do, because we have a research background, is really influence the conversations that are held at that policy level. But we also show the value of, for example, having a nurse practitioner who's a person who's authorised to do things that historically medical folk might have done, but these people can now work alongside of them. So I was one of a number of people who introduced the first nurse practitioner program here, and I think we were the first in Australia. So that was really very satisfying because they work all over the world now. But they work in areas like remote areas of Australia. They work with the First Australians. They work in, perhaps one might think, the less desirable places in mental health, but also in sexual health, places and spaces where people really need careful consideration of how they stay well. And these nurse practitioners are the peak of the nursing profession.
Do you have the opportunity to keep in touch with some of these people?
Yes, that's one of the greatest joys. And this year, the university is celebrating 25 years in the university sector. We've been within the tertiary sector longer than that. But at the end of this year, we'll be hoping that a lot of those alumni will come back. But I, for example, still work in places like South Korea and Thailand, and I meet up with my alumni. I still work with some of my doctoral graduates very closely, and I've mentored those into leadership positions. So I see that as one of my key roles today.
My mum was a nurse many years ago, and she, over the years, told many stories of shenanigans nurses get up to in hospitals, and the threat of doctors and the matron around them.
Yes, formidable people.
Do those nurses learn those little tricks from?
Absolutely. They life within a hospital, I think, hasn't changed all that dramatically, other than many, many more people going through at a faster pace and staying for less time. They pretty much look the same, and people behave in a similar manner.
Over the years, nursing traditionally was more of the female role. In your time here, has the balance evened up, male for female in nursing?
It's still anywhere between 10 and 14% of males. But I think across the world, what we've seen is a recognition. In some countries, it might have been totally female dominated, but today there are many more males in, say, for example, Thailand and South Korea than there might have been historically. But here it's stayed pretty constant. A lot of the men go into what we would call the intensive care units, or they might even become paramedics. They seem to like the hype and the action, and certainly females like that as well, but the males really excel in that area.
I guess a male would sooner be called a paramedic than a nurse.
Possibly. There are some males who are really quite... they certainly succeed, I guess, because they very often don't have the commitments of family and so on. They have some commitment to family, but it's not quite the same as being a female. But no, I think they're pretty comfortable. Most of them are pretty comfortable in their roles as a nurse. But yeah, paramedic is a good, acceptable title.
Can you think of, this might be a hard question, but can you think of one standout moment, day, a week, or achievement? That's
tough because I think there are many. I think for me, the pride that people feel at graduation is the really standout. But the graduation event that has maximum impact is the person who's a mum of several children, and they're graduating with a doctorate. And the family coming together and realising just what that person has achieved always brings me enormous joy. I can never take the smile off my face at graduations.